Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. In a previous episode, we covered 5 key facts about Lastacaft, a once-daily over-the-counter medication for allergy eyes. I discussed what Lastacaft is, who it's for, how it works, dosing and application, onset of action, contact lens precautions, and overall safety. If you have not seen that video yet, be sure to check it out. It's linked above. Today, we're going one step deeper with 3 lesser known but clinically meaningful insights every patient should know, especially if you're currently using Lastacaft or considering starting it. This information can help patients and families better understand where Lastacaft fits in the management of allergic conjunctivitis. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, here's something many people don't realize. Lastacaft, which contains Alcaftadine, is not just a standard H1 antihistamine eye drop from a pharmacology perspective. When we say antihistamine, most people think it simply blocks histamine. More precisely, during an allergic reaction, special immune cells, known as mast cells, cells that act like alarm sensors when they detect allergens, release a chemical called histamine. Histamine then binds to cell receptors in tissues like the eyes and nose, leading to itching, redness, and swelling. Antihistamines work by occupying those receptors, reducing histamine's ability to activate and trigger allergic response. The body has 4 main histamine receptors, H1 through H4. H1 is strongly linked to rapid, immediate allergic reaction. H4, on the other hand, is found on certain immune cells and has been associated with immune cell-driven inflammation, including what we call late-phase allergic responses. What makes Alcaftadine interesting is that research demonstrates it has activity beyond H1, including reported H4 receptor blocking properties. Clinically, Lastacaft provides fast itch relief similar to other antihistamine eye drops. However, its broader receptor profile may help explain why some doctors consider it a reasonable option when symptoms are more lingering or when inflammation appears more prominent. It is important to note that this understanding comes from mechanistic data. There are no head-to-head clinical trials proving superior anti-inflammatory outcomes compared with other allergy eye drops. In short, Lastacaft is approved for itch relief, but its drug profile suggests it may target a broader allergic inflammation pathway. Second, a common question patients often ask is, which allergy eye drop is safest during pregnancy? Historically, Lastacaft was classified as pregnancy category B under the older FDA system. This meant animal studies did not show evidence of harm to the fetus as studied doses, but there were no adequate well-controlled studies in pregnant women. It did not mean proven safe, only that no clear harm signal was identified in animal data. In contrast, many other antihistamine eye drops were previously labeled pregnancy category C, meaning animal studies showed adverse effects on the fetus or that data were lacking. Under the older classification system, Lastacaft may appear to have a more favorable safety profile compared with similar eye drops. However, this must be interpreted in context. The amount of medication delivered by an eye drop is very small, and systemic absorption is limited. In reality, we're often comparing one very small theoretical risk with another very small theoretical risk. Some patients may also achieve symptom relief with artificial tears or by optimizing nasal allergy treatment, rather than relying solely on antihistamine eye drops. My takeaway is this: if you're pregnant, trying to conceive, or breastfeeding, do not base your decision on a single letter category. Discuss your symptom severity, available options, and risk versus benefits with your physician so you can make an informed, individualized decision. Also remember that the FDA has replaced the old A, B, C, D, X letter system with a more detailed narrative format that focuses on actual evidence rather than a single letter grade. Third, and this is a practical tip when shopping for allergy drops, look at the bottle size, not just the price. For example, in the United States, Lastacaft is typically sold as a 5 ml bottle and marketed as a 60-day supply when used once daily. Another common comparator, extra strength Petaday once daily relief, is often sold as a 2.5 ml bottle marketed as a 30-day supply. If the shelf price appears similar, the difference in volume and how long the bottle lasts can significantly affect overall value. When comparing products, consider dosing frequency, bottle size, expiration date, and any multi-pack discounts or manufacturer coupons. Thinking in terms of cost per ml or cost per day may help you make a more cost-effective choice. And there you have it, 3 secrets about Lastacaft. Its broader H1 and H4 receptor activity, how to interpret pregnancy safety in context, and a practical strategy for choosing the best value of eye drops at the pharmacy. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.